This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right. So this is actually somewhat relevant to a stroke patient. So when we see stroke patients, sometimes a question will be, what can we do to help them, not get worse neurologically? And this was a trial that looked at patients with LVOs going to thrombectomy. And the question was, does the head of bed position matter? Head of bed flat versus head of bed elevated. Head of bed flat has a theoretical advantage of improving blood flow to the brain. Head of bed elevation prevents things like aspiration and other respiratory symptoms. So this was a trial that actually compared head of bed 0 degrees versus 30 degrees, and it looked to see, are patients more likely to have a worsening of their NIH stroke score while they're waiting for a thrombectomy. And this was a randomized trial that randomized patients to either group, and they actually stopped it early because there was a big difference. So after 92 patients, like 46 in each arm, they saw that of the people with the head of bed flat, only one had worsening of the NIH stroke score, whereas in the other group, it was like 26 patients had worsening of their NIH stroke score. We would ask also, did the people who were laying flat have more problems like pneumonias or other respiratory problems, but they did not see a difference. So in this trial, it definitely seemed like if you have someone with an LVO, a stroke, waiting for a thrombectomy, they're better off with the head of bed flat to prevent them from getting worse while they're waiting for their thrombectomy. The one caveat is that in this trial, there were some kind of problems with randomization, so the groups weren't totally equal, so it's not a perfect trial, but I think it's relatively simple, very cheap thing to do. So if someone isn't looking like they're about to aspirate, it's probably worth laying their head of bed flat until they get their treatment for their stroke. Questions? Thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.